show, Selena. It just does. I'll do the reunion show, by the way. Okay, now, you mentioned under Trump when healthcare.gov wasn't really advertised, it didn't have the lower premiums, enrollment went down. What's been happening since Biden took office?
Enrollment has hit record highs nationally. There are now more than 21 million people enrolled, and enrollment has grown the most in red states, according to a recent report from KFF. For example, in Florida, where Clifton lives, and in West Virginia, enrollment has more than doubled. And the biggest growth was actually in Texas, where enrollment tripled between 2020 and 2024. Another factor I want to mention is that Medicaid grew substantially during the pandemic because of rules that allowed people to keep coverage uninterrupted. Those rules expired last year, and experts were really worried that a lot of people would lose Medicaid and become uninsured. But Cynthia Cox,
you're gonna lose all that if Trump come back.
Was this
all happened because Biden in office.
Millions of people did make that transition onto ACA marketplace plans, which has helped keep the uninsured rate very low.
The uninsured rate in 2023 was 7.7%, according to the Federal Health Department, which is lower than it has ever been.
All right, so one clear difference between the candidates is their approach to healthcare.gov. What are some other health policy differences?
Well, Biden has managed to get some significant health policy laws through, including the Inflation Reduction Act, which allowed Medicare to negotiate the price of several very expensive prescription drugs for the first time. He also capped out-of-pocket costs for people on Medicare and fixed something called the family glitch. He's done a lot with nursing home staffing and mental health access, but one challenge for him is that some of the new laws take a while to take effect and be noticed by voters. For instance, the cap for seniors won't take effect until 2025. When it comes to Trump, Cox says there aren't a lot of details on the policies he'll push for, so it's instructive to see what he did as president.
What he tried to do was to deregulate health insurance, to try to make it cost less for the federal government.
So if Trump is elected, she expects more of that deregulatory approach to health insurance.
So there are some areas, though, of health policy where Trump is interested in regulating, and that's in two other areas that you cover, abortion and trans health.
Yeah, I think this is a really important point. So since Roe v. Wade was overturned by the Supreme Court in 2022, the Biden administration has been battling with states that have enacted abortion bans in the courts. And Biden instructed federal agencies to protect access to abortion where possible. The same is true for states passing laws about trans health policy. There are now 25 states with laws banning gender-affirming care for minors. The Biden administration has opposed those bans in courts and through agency actions. Trump has said he would take executive actions to limit access to gender transition at any age, not just for minors. And with abortion, he's spoken proudly about how he's responsible for overturning Roe v. Wade with his appointments to the Supreme Court. He would certainly reverse the current federal position that access to abortion is a right. So this is a really strong distinction between the candidates when it comes to health policy.
Are there any areas of agreement here? Anything that you might see continue regardless of who gets elected?
Yeah, there are a few. I mean, both have talked a lot about the high cost of prescription drugs. Biden has made moves to curb those prices with the copay caps and Medicare drug negotiation we talked about. Trump talked a lot about drug importation from countries like Canada with cheaper drugs when he was president. There was a law passed under Trump called the No Surprises Act to protect patients from exorbitant ER bills, and Biden has implemented that law. And price transparency is another area of some agreement. This is the idea that you, the patient, if you can see the price of services from your hospital or insurance company, you can shop around to find the best price. So it's not clear how well that's working, but it's something that has bipartisan support. But I think these areas of agreement are the exception, not the rule. These two candidates have extremely different ideas when it comes to the federal government's role in health policy.
That's NPR's Selena Simmons stuff, and thanks a lot.
Thank you.
All right, so there it is. There you have it. You see what the deal is. Trump, he ain't trying to do nothing for the little people. It's all about money. He not trying to lower the price of U.S. drugs. He want to import something from somewhere else cheaper if it's too expensive here. How about you regulate those companies? They out of control. They've been doing all of this stuff, using Americans as science experiments for all these years. You know, it's a greater chance that you get cancer than you won't get cancer in America. With all the poison in the food and the medicine, the poison in the medicine, it's crazy. But yet, They still going strong. Still going strong. Why? Basically because we're letting them do it, fellow Americans. Ask yourself, what are you personally doing to stop it? You go out to these shows and pay these crazy ticket prices, and what do? Keep rising the prices of the ticket. We go, we fly here, we fly there, and what do? Keep raising the prices of the tickets. Like, we need to start standing up for ourselves, fellow Americans. We really do. This is crazy. It really is. We've been taking it for so long. It's time for us to get it together. Wake up, America. They've been screwing us all these years. The word is out. No doubt, it's time to vote independent. 2024. No more in 24. No more in 24. Vote independent.